Hi, good afternoon, everyone. It's Friday, May 8th. I'm Randy Murphy, epidemiologist and director of disease surveillance and environmental services at the Mobile County Health Department, here to give our daily update on the pandemic affecting Mobile County, the COVID pandemic. As always, we'll start with some international numbers. So worldwide, almost 3.9 million confirmed cases of COVID-19, with just over 270,000 deaths. In the United States, 1,256,000 COVID-19 confirmed cases with over 75,000 deaths. And this morning on the Alabama Department of Public Health real-time dashboard, Alabama was reporting over 9,000 cases of COVID-19, so 9,046 confirmed cases with 369 confirmed deaths. In Mobile County, today we're reporting on 1,369 cases of COVID-19 disease, with 178 of those, or 16%, who've been hospitalized, and 79, or 7.4%, who have died from COVID-19. Today, our health officer reminded us persons over the age of 50 in the Mobile area have a majority of medical outcomes that are not good. Yes, Alabama is doing okay, but right now Mobile has a higher transmission rate than other parts of our state, and persons over 50 years of age and those individuals with other medical conditions need to exercise caution with leaving their homes. So we'll talk a little bit more about some of the other news that's gone around in our state today, from Governor Ivey and Dr. Scott Harris lifting some of the restrictions. But first, let's just talk a little bit more, as we do almost every day, about the characteristics of our cases here in Mobile. So the majority of cases are occurring between people who are 25 years of age and 64 years of age. So those are the folks who, if they get infection, they're going to likely have a mild illness that can be managed at home. And because this is about 62% of our cases, we know that these are the people who are spreading COVID infections throughout our community, right? They're well or mildly symptomatic, and these are the folks who, we worry about complying with medical or the public health orders and that sort of thing. So if you're between the age of 25 and 64 and you have tested positive for COVID and you have mild illness, please stay at home and follow the public health restrictions about physical distancing and covering your cough and washing your hands and staying at home if you're sick, those sorts of things, because we need you to not be spreading your germs around to those that are most vulnerable in our community, which are those folks that are 65 and over. That's 25.5% or so of our COVID cases. And then again, also we know that medically fragile folks, are people who have underlying conditions or disabilities, are also susceptible to severe complications of COVID disease. So around 15% of our cases are known to be healthcare workers. Just over 8% are employees of a long-term care facility, 15% residents of a long-term care facility. So that's an important number, that around 23% of our cases are known to either be employed or reside at a long-term care facility. Again, we have outbreaks going on in many locations, but we have many who just have one or two cases. So I'll give a little bit more information about that in a minute. And then among all of our cases, about 20% have recovered or are no longer reporting illness, and thanks to a reporter who caught an error in that figure yesterday. All right, so let's talk a little bit more about severe outcomes. Among the 178 who have been hospitalized at some point during their illness, really about 90% of them are over the age of 50. We've only had about 20 people less than 50 years old that have been hospitalized, and fortunately no one under the age of 5 years old has been hospitalized. So remember, if you're in that 50 and over category, you account for about 90% of the COVID patients who are hospitalized. So please monitor yourself, protect yourself from infection when out and about the community. Monitor yourself closely with symptoms, and if you do have symptoms of COVID, seek consultation with healthcare early. Other characteristics about our hospitalized, this is staying pretty steady now, that around 44% of them have required intensive care while hospitalized, and almost 25% have required mechanical ventilation during their hospital stay. So a little bit more about those folks that have died. We are reporting 79 today. It's just tragic that we are losing Mobilians every day to COVID infection. So 99% of those who died are over the age of 50, with almost 75% 65 and older. So again, if you're in these age brackets, please continue to stay safer at home, and let other folks run your errands, family members pick up your prescriptions. Try to protect yourself as our community starts to open back up, and we are bound to see more opportunity for transmission around our community. So please protect yourself. And if you are a young, healthy person with parents, aunts, uncles, grandparents who are in these age categories, please, when you are out and about in the community, protect yourself so that you can protect your older loved ones. We know that there's asymptomatic infection, there's pre-symptomatic infection. So I am the greatest risk to my elderly neighbors, to my grandparents, to social circles that I sometimes interact with, because I'm out and about in the community. So if I don't protect myself from infection and get infection and have a mild illness or no symptom at all, then I am the one that is going to transmit COVID to someone who is elderly or has underlying conditions without even knowing it, and then they are at risk of hospitalization and death. So it's important that we all recognize the part that we play in protecting our citizens from hospitalization and death due to COVID. Yes, 80% of us will be mildly ill, but it's who we spread those germs to that we're most worried about. So please continue to social distance, physical distance, use your hand hygiene, stay at home if you're sick, don't gather in congregate settings, stay 6 feet apart when you're out and about in the public, in retail settings, in restaurants, in big box stores, all of that. So please help us protect our most vulnerable citizens. So let's see. So a little bit about outbreaks. The good news about what's going on in our correctional facility is that they have less than 10 inmates there that are currently ill, and they're doing very well and expected a full recovery. So that's really good news for our correctional facility, and they are doing the things that they need to do to try to eliminate the spread of COVID in that facility, either among inmates or among correctional staff. We have outbreaks at 3, 4, 5, 6, 7 long-term care facilities. We have senior citizens apartment complexes that we're talking to. We have treatment centers, and looks like that describes just about everyone that we're working with. So again, I think we have at least one case in most of our long-term care facilities. We have 22 sites that have reported no cases or symptoms. So that's 22 out of 37 long-term care facilities that have no cases or symptoms. So the balance there, it's about 15 that we are keeping close our eyes on because they have at least one case. And as you know, because they have reported, several of our long-term care facilities have many residents and employees that have contracted COVID disease. So let's see. All right. I seem a little disorganized today, don't I? All right. Let me talk about the new state order by the health officer that was amended to publish today and goes into effect on Monday. You probably have already seen this in the news, but what this has done is the Safer at Home order has been amended, And I'll just quickly go over some of these things. It doesn't go into effect until Monday, not this weekend. So please help us stay safe. So they're removing the 10-person limit on non-work gatherings, although you're still required to maintain a 6-foot distance. Restaurants, bars, and breweries may open with limited seating. I think it's about 50%, and they have to have a 6-foot distance between tables. And there are some other, of course, sanitation guidelines that they have to follow. Athletic facilities such as fitness centers and commercial gyms are open, subject to social distancing and sanitation rules. Close contact service providers such as barbershop, hair salons, nail salons, and tattoo services may be open, but they are also subject to physical distancing and sanitation rules. Beaches open with no limit on gathering, but you must maintain a 6 feet separation. And then these are the things that are staying the same. Individuals are encouraged to stay at home. Businesses may open subject to sanitation and distancing guidelines, and certain higher risk businesses and activities must remain closed. All retail stores can open subject to 50% occupancy and physical distancing. Entertainment venues such as nightclubs, theaters, bowling alleys are still closed. Medical procedures are allowed unless prohibited in the future to preserve resources necessary to diagnose and treat COVID. Senior citizen centers, their regular programming is still suspended, except meals still available through curbside pickup or delivery. Educational institutions are still closed to in-person instruction, except for daytime special activity programs. Child daycare facilities still must not allow 12 or more children in a room, and hospital and nursing homes still must implement policies to restrict visitation. So still no visitation in long-term care facilities. And you'll see on our website that there are, one of the big changes that isn't on this is that there are guidelines for places of worship that now may continue having services as long as they implement the 6-foot physical distancing and other sanitation guidelines. So you'll see this for guidelines for places of worship that provides a lot of detail. Also for restaurants and bars, for close contact personal service businesses. This is by far the greatest amount of guidance. So if you're a barber or a nail salon, please read this carefully and make sure that you can implement these things before you open. Guidelines for athletic facilities and guidelines for safeguarding all small businesses. So these you can find on the state website, on our website, and please download and adhere to those guidelines for physical distancing and sanitation and wearing of face coverings when you open your business. All right. 2 other things. Mark, I don't have the the news release about family health opening. Sorry. So I just we had a question yesterday about the use of hydroxychloroquine, and I had said that we weren't recommending it because everything was still in clinical trial, and there was a health alert notice today that emphasized that FDA advises caution on the use of hydroxychloroquine outside of hospital and clinical trials. So please be careful. Again, we don't want to cause more harm than good. Some big news that that Mark's trying to find for me is basically that Family Health, the primary care division of the Mobile County Health Department, on Monday will open all of its locations throughout the county. So all of our services will be opening back up next week. And in addition to providing normal services, we also will be providing PCR testing. Thank you, Mark. PCR testing for COVID-19 at all of those sites. So again, starting Monday, we have changes in our operations at Family Health, the primary care division of the Mobile County Health Department. Starting Monday, all locations will be open from 7:30 a.m. to 4:30 p.m. on weekdays. And for a list of locations, you can visit familyhealthalabama.org. This applies to our Children's Health Center at Newbern, the Citronelle Health Center, the Dauphin Island Parkway location, 8 Mile, North Mobile, Sims, Southwest Mobile, and Women's Health at the same location as the Children's Health Center, and then our downtown location on North Bayou Street. The other big change is that our medical triage pharmacy refill lines are going to be directed to our main switchboard now. So the main switchboard is 251-690-8158. So those lines that we stood up, including the COVID information line, will no longer be manned. Everything will just be going to our main number as it normally is. We still can direct COVID questions to the State Health Department at 800-270-7268. So again, all persons visiting a site will be screened for illness prior to entering the building, and patients and visitors over the age of 2 are required to have a face covering on before entering the building. So that's important. So come prepared with your own face covering if you have one, and if not, we will figure out how to accommodate you. Adult patients should come alone. Pediatric patients are limited to one parent or guardian. Family Health will continue to offer telehealth services for all life cycles with primary care and optometry. So please call the appointment line to secure a time, even for telehealth. Vital Records is still open downtown, and I don't think that's changed. I'm sorry?
5 days now.
5 days. Okay, sorry. Mark's telling me that Vital Records is now opening all 5 days, weekdays, 7:30 to 4:30. I think that's about it. Okay, thank you. All right, I'll just hold on to your phone. Okay, a couple of questions that have come up. Let's see, a media question. I always think I should have read these before I look at them. Let's see. A politician in Mobile say he felt that Mobile County should allow for random testing for a short period of time to get a better understanding of how prevalent the virus is in the community. So we know that testing, the availability of testing has gone up dramatically since we first started talking about this in March. I looked at some numbers. Early March, in Mobile County, only about 125 residents a day were getting tested. And as recently as last week, 450 a day were getting tested. So we think we have plenty of capacity for testing. And if you feel like you need to be tested for COVID and you've not been able to find a location to do that, then call our appointment line and you can get tested at one of our locations around the county. The appointment line is 251-690-8889, and we will test you regardless of your ability to pay. So I just want to make sure that you guys know that we're hearing that we needed more testing sort of out in the areas, so we're getting that done. And there was a comment then about, is it time for us to do a point prevalence study? That's not what they're asking for, but right now we're still very early in the duration of this outbreak, and I think stopping now and diverting resources to doing a point prevalence study where we kind of randomly test people in Mobile County, I don't think that's the best use of our public health resources right now. But CDC is doing some of that work in some of the cities that were impacted very early on and heavily. So I expect at some point we will get more information about that, but Mobile County Health Department will not be doing that. Focused on Mobile, it's odd that so few cases in Baldwin County, considering how linked it is to Mobile. Is this unusual based on the experience? So, I've only been with with Mobile County Health Department for about 7-8 months. But for Mobile County, I've seen this similar trend with another outbreak that we've had, a hepatitis A outbreak, that it seems like transmission in those younger age groups, so 24 to 64, that it comes from the west, not from the east. And so it seems to be moving along the I-10 corridor, sort of coming from Louisiana through Mississippi and then into Alabama and on over that way. So I we see this difference with lots of diseases where Mobile has more cases than, you know, a neighboring county to our east or to our north. A lot of that, some of that has to do with density, population density, and some of it has to do with other health disparities and known socioeconomics differences between our populations. What is the status of COVID patient bed capacity and ventilators in area hospital? The status is that the capacity is good. It is more than sufficient for the need. And that is really good news, and partly why they are able to start rescheduling elective procedures. There's a question here about rare complications in children, something called pediatric multi-system inflammatory syndrome. Sorry, I've not read up on that, so I'll get back to that maybe next week. Someone was asking about some changes over time in the number of deaths that we were reporting on the daily report. So I'm going to look into this over the weekend, because, you know, we are not perfect. We have errors. It happens. We try to do our best, but sometimes it happens. So I'll look at it over the weekend. But I will say that these are ongoing investigations, right? We are reporting data on investigations as they are happening. So I keep, you know, said that we're like building the ship while we're trying to sail it. And, you know, it's not a surprise that we maybe counted a case today as a Mobile County case, and then, you know, later on in the day we found out that they actually live in George County, Mississippi, and then we would transfer the case to Mississippi. So this sort of thing happens a lot with surveillance data, particularly when we're reporting it as quickly as we do now. In normal times, we have the luxury of taking several days, making sure all the information is as accurate as we can get it, and then publishing that data. And still, we usually wait a few weeks before we report it out. So I'm not concerned about when numbers kind of fluctuate, you know, in and out as the days go by, because these are real-time data that we're sharing with you. Let's see. Will you start testing in all nursing homes? We are testing in all of the nursing homes that have, you know, patients or residents that are suspected of carrying COVID. And even in the nursing homes that do not have any cases, we've been working really hard over the past, you know, month, 6 weeks to make sure that they had capacity for testing in-house, so that when they suspected someone as a COVID carrier, that they could test them right away. So we have a lot of testing that is going on in nursing homes of both employees and residents. If you are an essential worker and cases are noted on your job, what's the process for testing other workers? This depends. If public health notices that there is a cluster of disease associated with a particular location, we will investigate that and try to provide advice. Sorry, I was trying to say guidance and advice at the same time. Provide advice on who should stay home, who should get tested, disinfection, infection control, those sorts of things. So that is and then we decide in consultation with the employees and with the business owner what employees need to get tested, and then if we need to, we can arrange to have them tested either at one of our locations or someplace else if the worker is insured, for example. But we've not done that. We've not had a cluster investigation at a business other than a healthcare facility or a correctional center that I know of. But now that I've said that, of course, it's going to happen, no doubt. Okay. Is the low population rate as compared to other southeastern states a result of testing being delayed in Mobile? No, I do not think that is the case. As I said, data that I have seen that you guys have not shows that week over week, we have the bars have gone like this on how many people are getting tested, right? And the cases are not going up like that. The amount of tests, the number of tests we're conducting is. So I don't think that has that's due to delay in test results. Has anyone died at home? I don't know the answer to this question. We had a couple of investigations of people who died at home that had no other reasonable explanation for their death. I think we had 2. and postmortem specimens have to be collected, and then those have to go to the state lab and to CDC. It takes a really long time to get that information back. So I don't know the answer to that question. When will bars and nail salons open back up? May 11th, as long as they are following all of the physical distancing, disinfection, and protective procedures for their customers. Let's see. All right, and I think that is it.
One from the media.
Okay.
It stated bars are allowed to reopen on Monday, but nightclubs are not. Does it say what the difference is?
So the question is about nightclubs can have to close, but bars can stay open. So we asked Montgomery, this question started almost immediately, and we have asked Montgomery, we've talked to the ABC board, we've talked to Montgomery Inspection Services, the folks who statewide inspect bars and restaurants and nightclubs, and no one seems to know that there is an official definition of nightclub in Alabama, or how a nightclub differs from a bar. So stay tuned on that. I expect you'll see some clarification in an FAQ that's going to come out of the mayor's office very soon. But in general, a nightclub is a place where you might have music and dancing. Look it up in Webster's dictionary. I think that's what it says. So if you are a bar that has music and dancing, then you probably should not plan on opening on Monday night. But if you are a restaurant with a bar, or I think even social clubs that have a bar can open, but again, you have to be able to maintain that 6-foot physical distance between patrons. So more to come on that. All right, thank you all. Have a lovely weekend, and we'll talk to you again on Monday.